physics, art, and math guide us down this path. Historical tales come alive, where science and stories dive, blending facts with heart, knowledge from the start. Neath rich blues we sing to the future memory. Health and science in the mix, Maybridge got the fix. Complex subjects make
right
clear
now
every episode
in ways that we actually acquire
leads the way,
and ways that make me more efficient.
in the world of digital streams, turning knowledge into dreams. Through the tales of old, new stories unfold.
Thank you so much for joining with me. It is truly an honor and a privilege.
MedBits Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges
Dr. Reddy, Prasanth Reddy, is joining from Kansas, Mission, Kansas. Is going to join with us. Let me bring him to the table and give him a little bit background of him, and then let us see. He recently ran a contest in the general election in the U.S. Congress. So we want to ask his experience. Let us see what he says. So, Dr. Reddy, welcome to the MedBix webcast.
Thank you, Raman. It's my pleasure to be here, and thank you for having me on again.
Okay, thank you. It is a privilege. Tell us a little bit of your journey up to this point. I'm going to, give us a little bit about your background, a little bit, if you don't mind.
Yeah, for sure. Happy to. I'm a physician. I'm a cancer physician. I've been trained in both medical oncology and hematology, and of course, before that, in internal medicine. I've been practicing for nearly 2 decades, and I've had an interesting journey in healthcare. I have a master's in public health, and I've had the opportunity to take care of patients pretty much across the entire healthcare ecosystem, with experiences in both academics as well as private practice and in managed care clinical settings. And I've had the opportunity to work, in industry with a better understanding of the drug development life cycle with my last role, where I was the senior vice president and global head of oncology at Labcorp diagnostics and for Labcorp drug development. So I do have a pretty good understanding of, the biopharma space and biotech in general. And then, of course, the importance of diagnostics in, providing some guidance on how best to take care of patients. And so there's overlap there, of course, with, healthcare systems. And then, of course, the pharma industry, as well as the payers that provide access to care that's so critical to ensure that patients get the best care possible.
You have impressive credentials. That's very impressive. You ran for Congress recently, and then tell us a little bit about your journey through the process. It is a very hard work. I can see that what you went through. But tell us a little bit about that journey. Why physicians has to involve they need to contest more elections, and then they become elected leaders. Why you think so? Give us a little bit background about that.
Well, I've always believed in public service, Ramana, and I think it is important that every citizen in this country, every person in this country is well informed to understand the importance of public policy and the impacts on their lives. And certainly this is true for healthcare. And I personally do believe that there's just not enough physicians in Congress, in DC, to affect public policy in the right way to ensure that all patients have access to the world-class care that does exist in the United States. And so it is critical that people get involved, and I'm glad I did it. As you know, unfortunately, I came up short, but I'm proud of not just complaining about sometimes the challenges in DC. We all have a choice to make, and sometimes putting yourself out there and saying, okay, I understand these are complicated topics and issues, but I'm going to step up and try to do my best to at least provide a different set of perspectives on how best we can help people.
A lot of public in general, they have pessimism about these elections and these elected leaders. There's a lot of confusion. And what do you think of that overall optimism has to be there? What do you think that is lacking in that? What is going on? What is missing in these election cycles?
I think sometimes people get frustrated that their voices aren't being heard. But Ramana, one of the things I told many people is that I always have a positive lens on life. You got to look at life as a glass that's half full, as opposed to a glass that's half empty. You can make a difference. Sometimes in life things aren't a straight line, But the important thing is that you don't give up, and that you advocate for the things that are important, those things that make you, excited, even there, if there's frustration or it's not an easy thing. Take my word for this. It is always worth the fight. That is what makes life rich and full, and that is what makes our country so special in the United States, and certainly any democracy in the world. We take a lot of our freedoms for granted, and we shouldn't do that. The reality is that making sure you're engaged and educated, and an active participant, certainly exercising your right to vote, is an amazing thing, and we should all be thankful that we have the opportunity to live in such an amazing country, where we can make our voices heard.
I'm glad you have that optimism, and we need that. Um, Let me ask you: American healthcare system is a paradox. Rich don't like it, poor don't like it, doctors don't like it, patients don't like it. What is this lack of trust in the is pervading this in health American healthcare system? They lost so much confidence, and then if you compare even in third world countries or developing countries, or I don't want to say third world, but developing countries, they have a better healthcare system. Sometimes I feel that. What do you think of this healthcare system situation like this happened? How we can correct why it happened, and how can we correct this system? We think.
Yeah, it's such an important question. Literally one in 20 cents out of every dollar goes to healthcare in the United States. Despite that, our life expectancy, if you're born in the early 2020s, life expectancy is around 78 years of age. And relative to the rest of the world, relative to the dollars that we spend in healthcare, we are seeming to fall short. We can do better, but I don't view this frame in a negative sense. It's an opportunity. Yes, there are challenges, but challenges are opportunities for us to get better. And I think some of the things that we need to improve is, number one, continue to innovate. And I do believe America is the world leader in healthcare innovation. But where we struggle is making sure that innovation reaches people, and that's access, and that is ensuring that we improve healthcare implementation. Because at the end of the day, all of the amazing things that we do in the United States from an entrepreneurship perspective or from an innovation perspective, it doesn't matter if it's not getting into the hands of patients. And so I think we have a lot of room to get better in talking to patients, talking to citizens about the importance of healthcare in their life journey. In many cases, certainly I was born in India, and I remember my mom, who I lost recently, always used to say a saying, which is kind of like an Indian proverb: health is wealth. And so, yes, we want to, strive for things that are important in life, including, generating wealth. But if you're not healthy, the rest of it won't matter. You won't be able to enjoy your life. And I do think we need to do a better job of translating that, educating the public on the importance of prevention of illness, making sure that the public, again, understands the importance of taking care of themselves. An ounce of prevention is worth a pound of cure. And that's certainly true in cancer medicine. Despite of all of the awesome things we've done in personalized and precision medicine to improve outcomes for cancer patients over the last couple of decades.
What is the cancer? Let us talk about the cancer, and is growing in the world. The cancer, we are getting older. The American population is getting older, and a lot more cancer is coming up. How do you address this massive requirement for the cancer demands for the healthcare services and the overall healthcare services? How do you address that, Dr. Reddy?
Yeah, it's a very important topic again, Ramana. As you know, one of the benefits of living in the United States is that we're not killed by a saber-toothed tiger, and we do live long enough where chronic illnesses have now become the biggest healthcare challenge for us. And it's not typically in many parts of the world still infectious disease and public health, public sanitation is such a challenge. But yeah, I mean, cancer is critically important. If you look at the age-adjusted death rate for say 100,000 people, cancer is the second leading cause of death currently, with about 150 deaths per 100,000 people being age-adjusted. And by 2030, there are predictions that it'll overtake heart disease in becoming the number one, most deadly chronic illness that faces the nation. The amazing thing, though, again, the good thing for me is while I've been in industry, I also take care of patients, and some of the wisest things I've learned is from my patients. And I can tell you, there was a time when I had patients with various cancers that, even though I knew that they were getting worse, their disease was getting worse, there was nothing I could do. And the truth is, we have bended that curve with innovation. There are things for us to do. We've made tremendous advances in personalized and precision medicine. And a lot of those advances are related to diagnostics, both imaging and laboratory improvements. So we understand the biology of the disease in a much better way today as to what's driving a person's cancer, number one. And then number two, when I was practicing early, we were getting better at understanding what was driving cancer, but we couldn't do anything about it. But today, the explosion of therapeutics, both not just conventional therapies, but also targeted therapies, say small molecules or targeted therapies against certain mutations that patients with certain cancers have, is really so much more advanced today than it's ever been in the history of humanity. And then we've also got these new categories of incredible therapeutics, including, immunotherapies that for somebody like, we just lost, amazing American, amazing patriot, President Jimmy Carter, who is dealing with, stage 4 melanoma. And he had a significant extension of his life because of particular immunotherapy agents he was exposed to and taking. And that wouldn't have been possible, 30 years ago or 20 years ago. And so these are the advances that are so critical. And maybe underpinning all of this is data. And so today, because of data science and extending from data science to, say, artificial intelligence, which sits on high quality data science, and actually using that kind of technology to make better decisions for patients. Gosh, this is an amazing time to be alive. It's an amazing opportunity for people to make a difference in the lives of patients if they want to get involved, and if we have the right public policies to encourage innovation while at the same time ensuring that we improve healthcare implementation.
Before we get into the data and the AI, let us talk about a lot of people think cancer is a death sentence, but it's a bigger than a death sentence, is a financial burden. That's another death sentence people think. How do we address that? The people, reducing the burden of the financial burden on the cancer patients. What do you suggest?
Yeah, again, the first thing is simple, right? In life, there is a clear mantra that we should all take seriously. And I said it earlier, prevention of disease is much better than trying to treat disease. Prevention of disease is also a lot cheaper than trying to treat illness. So whether we're looking at our nutritional recommendations for the country, our recommendations for exercise and physical activity, whether we're looking at making sure that our mental health is appropriate because of its implications on how people live their lives and what they might eat and how they exercise and how they're engaged, these things will reduce costs. So that is also true in cancer medicine, by the way. The truth is that regardless of all these amazing therapeutic innovations and our understanding of disease, I can guarantee you with personal experience that if you're not eating a good diet and have the building blocks through nutrition to fight your cancer, if your headspace is not in the right place and you're depressed or you're anxious and we don't correct that to make you feel more comfortable that you can beat cancer, you're going to do worse. And then exercise and staying physically active is critically important for fighting any illness, and that includes cancer. In fact, there have been studies in breast cancer where mortality is actually improved with folks that are exercising actively and staying physically engaged. And so I do think those things can help reduce our having to deal with cancer that is advanced, and hopefully reducing the overall incidence rates of cancer. Really, we need to make, to borrow another phrase, we really need to make America healthy again, and look at, ultra processed foods, and looking at, what kinds of national policies we can implement to ensure that we're starting this at a young age, so children, so these habits stick through childhood and extend into adulthood. And we ensure that people are understanding the importance of, staying active, and maybe looking at public policies like, silver sneakers and other public policies that are designed to ensure people stay active. Now, I will suggest to you that financial toxicity of cancer therapy is real. Unfortunately, I've had to deal with this, and I've had a lot of patients who unfortunately, wound up, because of the costs of cancer care, if they didn't have appropriate coverage, they might unfortunately lose their home. They might, have personal problems, including getting divorce on top of dealing with healthcare issues like cancer. And so those things are things that we have to mitigate. And at the end of the day, this also ties into this concept of social determinants of health, where access to healthcare services, trust in healthcare services, so you feel comfortable with talking to physicians about what you need to do to overcome your illness. These simple things like, can I drive down the street so I can access a clinical trial? Well, if you can't pay for your trip to your cancer doctor's office, I can guarantee you that person is going to do worse. So we do have to think about these various social determinants of health. Think about how the financial toxicity of cancer care can be mitigated. And there's a lot of things we can potentially do to help mitigate the current explosion, uncontrolled costs of healthcare, including in cancer care.
You build a casino and expect no one should play there. Fee for service model is that kind of a model that sick care is really rewarding the doctors. So that model, what you're saying is exactly, is the best interest of the people in general in public. But a lot of the healthcare systems don't play that role. We need to change that system? Do you agree?
Yeah, so it is a great question, and again, I'm not going to be, make light of the situation, but the honest to God truth is, physicians, if you look at the Medicare fee schedule, physicians haven't had an increase in the Medicare fee schedule for decades. So when you look at the explosion of healthcare costs, this isn't directly attributed to the providers of healthcare. What has happened in our healthcare ecosystem is that other players, including, how we decide what something costs and lack of price transparency. When we look at payers, when we look at healthcare systems, and we look at the delivery of healthcare, there's pharmacy benefits management. There's all of these different players, key stakeholders in the healthcare ecosystem. And we have a lot of competing interests. And I do believe in each of these sectors. I don't think that, these folks are, looking at how they can hurt patients. I don't believe that. What I do believe is that they're stuck in their silos. And it is the role of government, it's the role of public policy to look across this landscape and figuring out, how do we get all of these key healthcare stakeholders, from patients at the center to providers, physicians and other healthcare providers, and working with healthcare systems, working with payers, working with pharma and biotech, and some of these other organizations, to try to figure out how we can bend the cost curve while we don't impact innovations, and we can improve implementation of healthcare delivery.
Let us talk about how the artificial, I'm in the center of Silicon Valley. I live in Silicon Valley. We think that we all blinded by artificial intelligence now. We think we can solve every problem through artificial intelligence. I don't know. I have a lot of hope and I have a lot of confidence in it. But tell us a little bit about your journey into the artificial intelligence, how it can help the entire healthcare system, and then generally, particularly after that, cancer patients and cancer itself.
Yeah, it's a great question. And again, this is where, in my life, I've been, honored. I've been, blessed to have an ability to really take a deeper dive, into this world. And so when you look at, say, genomics data, the truth is a lot of that is data science. So we need to build high quality data sets that are representative of the entire patient population. Just to give you a simple example, in the early 2000s, there was a recognition that in lung cancer, a special kind of lung cancer called non-small cell lung cancer, that many of those patients could have a specific mutation in their genes that are driving their lung cancer. And I'm just going to pick one. There's many mutations, but one of those was something called EGFR, epidermal growth factor receptor. And so back in the early 2000s, there were drugs that were designed to beat, this aberrant pathway that was driving patients with lung cancer. But you had to identify those patients. And so when they did trials looking at all lung cancer patients, including patients that didn't have that mutation, and they used these drugs that blocked that mutation, the outcomes didn't, meet clinical trial endpoints to suggest efficacy. But the truth is that when we figured out how to test for those patients and then put the patients that had that mutation on the right drug at the right time for their, for their specific disease, it worked. And that is data science. But that data is also nuanced. And so EGFR mutation rates in Asian Americans is almost 50%.
Oh.
And it's not the case in every single patient. Like if you're a Caucasian, or if you're African American, or if you're Hispanic American, that rate of mutation isn't the same. So data matters, testing matters, ensuring we test an appropriate population is going to ensure that we have high quality data. And the reason why I bring that up is that if you train artificial intelligence, which requires high quality data to help train it, to then help the algorithms make the right decision over time as you get more and more high quality data, then you're going to improve outcomes. But if you're training the wrong, training data set, and you're teaching artificial intelligence the wrong things because of poor data, it's not going to work. In fact, that was one of the challenges with some of the early interventions where we were looking at things like, say, some of the awesome work that was done at Watson. If you just look at how healthcare implementation is done through clinical trials, and then you look at how healthcare implementation is done outside of clinical trials, say in the community setting, as opposed to an academic center, well, those data pieces don't carry the same weight because you're not looking at the same set of variables that could be impacting those patient lives. And again, I'm grossly oversimplifying this analysis, but the idea is that even artificial intelligence requires that we have the appropriate data set that we're training the artificial intelligence, and it has the ability to glean the right insights out of that data. So I'm super excited though, Ramana. I mean, because we are at the precipice of so much real world evidence, real world data that's accessible through electronic medical records, through registry data. When we look at, say, morbidity and mortality data that the payers have, or you look at the clinical trials data that we are now trying to expand, not just in in academic centers, but making sure that these trials are done in the community setting, where literally 70% of patients are still getting their treatments. That is what it's going to take. And if we're able to bend that challenge, if we're able to tackle that challenge, the promise of having this incredible rich set of data at our fingertips, and then using artificial intelligence to be appropriately trained to glean those insights, so those insights are applicable to a broader patient population and easily accessible to everybody. Gosh, we are going to make a huge, huge positive difference in the lives of patients.
Don't you think we need a legislation for the interoperability to get the data? Because data, as you say, data is the critical to get the right drugs and the right the therapies. If that is the case, we need a really good data, clean data. What do you think of that data to be that we need to have a legislation. We don't have a access to data. MD Anderson don't want to give it to them. Epic doesn't want to give it to anybody. How these companies, how can we make it make it possible that do that?
Yeah, look, again, I'm going to tie back. It's always good to tie back to some of the things we've already talked about. Yeah. This is going to tie back to the earlier concept of public policies. Right now, the data policy of how we look at healthcare data in California is different than other states in the country. And in fact, globally, how data is handled in Europe is different than what it is handled in the United States. Of course, there's concerns for how we look at data, right? We've got to ensure, data privacy, data security. That is going to be really important. And a lot of that is, again, going to be tied to public policy. But if we do this right, in my mind, there is no doubt that artificial intelligence, when used appropriately with the right framework, the right guidelines, we can revolutionize healthcare. We can improve patient outcomes, including survival rates, but not just survival rates, quality of life. And we can also use, this kind of technology to, again, think about ways we can improve and overcome social determinants of health and improve the efficiency of healthcare delivery. But to do this effectively, it's going to ensure that, as this new administration is getting ready to, take their position in DC, that, leadership, including, HHS Secretary and nominee, Robert F. Kennedy, folks like Elon Musk and Vivek Ramaswamy and other folks that are going to be influencing these public policies. And of course, Congress, including, both the Senate and the House, and, folks like Speaker Mike Johnson, that these folks are aligned and they're going to allow this healthcare transformation where we can really foster innovations, including for AI, and we can ensure that we're going to adopt effective medical processes. And it'll be critically important to think about how this new administration is thinking through public-private partnership to improve healthcare lives in this country and, frankly, around the world.
But that is to get a public policy. We need voices like yours to be really heard. You're an important voice as a physician, and a public voice, important public voice. You are doing that. Thank you. Taking a busy time, your phone is ringing nonstop. Thank you so much. It is an absolute privilege and honor to me to have you. You're shedding light on the important aspect of machine intelligence and the human intelligence and the public policy and the of the data. All of them are important. You did a very great. You give important insights into it. Thank you so much, Dr. Reddy. I'm honored to have you in the last minute. Thank you for so much coming on my show podcast. Thank you. It is truly an honor.
Yep. Thank you, Ramana, for having me. I'm going to leave you with one thought.
Yes,
this responsibility to make healthcare, more accessible and more effective in improving patient lives and improving outcomes and improving, our life expectancy for this country and, frankly, around the world. Our responsibility is a collective responsibility. For us to be able to deliver these transformative solutions, it's going to take all of us. And if we do this right, we're going to be able to figure out what the promise of healthcare innovations tomorrow, and instead of making them just a promise, we can make them a reality today. And that is our collective responsibility. So I'm hopeful, folks like you, and certainly I would, like to continue to keep pushing our public policy makers so that we do this right and we can help people.
We certainly need voices like you in the public policy, and we need you. So thank you so much, and thank you for joining. Good night. Good night.
Thank you, Ramana. Bye now.
Thank you for that. That's a Dr. Prasanth Reddy, the star to watch. To be honest with you, is going to be a upcoming star. We need to, it's a kind of a, that is going to be a new star in the healthcare world. A leader to watch. So tomorrow we have a big thing coming up in Silicon Valley. Is my good friend Dr. Uri Chettipalli is running a innovator innovatormd.com is doing a big JP Morgan kind of a conference tomorrow. Is the annual conference. He starts tomorrow. He's starting. I'm very excited to attend that conference. I'm going to report to you what is going on there.